Welcome to the revolution in the airwaves. It's The Cure with Scotty and Sully, where we don't just talk about the medical industry, we transform it. This is The Cure with Scotty and Sully, where we don't just cover excellence, we create it.
Hey, welcome to The Cure with Scotty and Sully. We got another wonderful Friday morning, Scotty. You know, it's April, the sun is out, you know, the Masters tournament is now finished. You know, we're ready to move into our summertime. But you know what? Just because the weather's getting good doesn't mean we can't keep getting better. It doesn't mean we're getting ready to slack off all summer, baby, right? While everyone else is sleeping, we're just getting moving. And so like every week, our objective is really simple. It's you get 1 hour, you're going to go away with more knowledge and skill that you can actually use to make you better at leading, better at selling, better at marketing, better at having fun and enjoying your life. And we got one for you today, my man. His name is Dave Edwards. Scotty, take it away. Tell us a little bit how you know Dave, and then it's all you.
Yeah, welcome to the show, everybody. We are excited for this. Obviously, we're coming off a week of talking insurance to the wonderful world of GPOs and Mr. Dave Edwards, but more importantly, talking with Dave. I saw him present a couple of weeks ago, and he talked about finding your why. And I walked up to him after. I'm like, man, we got to get you on the podcast because that story is so good. And I've read the book. It's a great book. And Dave just presents it so well. He's one of the best presenters in the industry that I've ever seen. I love hearing him every time that we have him on a program, or if I see him on a program, if I'm there, I make sure I go. Dave is currently the Vice President of Business Development at Premier. He spent some time at Premier before. I'm not going to get into all of his background because he has a cool way of how he describes it. And so, Dave, with it, welcome to The Cure, my man, and looking forward to this conversation. Thanks for being here.
Man, I am so grateful to be with you guys, two industry legends. And from everything you tell me, Scott, this is rock and roll. We're just going to be honest. We're going to let it
wide
flow.
Open.
We're going to speak from the heart. So I'm grateful to be here and open to anywhere you want to take it, man.
Yeah, the thing that me and Sully love the best about this is just that it is wide open. It just we've got questions, but we'll end up talking about all kinds of stuff.
Organic. I like it.
For sure. Sorry, Sully, I stepped on you there. What'd you say?
No, well, I was going to ask, do you think Dave has an Italian accent?
I think if he's making a cold call, he could go into one.
Dave, can you give us your best attempt at an Italian accent?
I'm not going to do it. Not early. Maybe late. Let me get to know it better.
Hey, I like the Scotty and meatballs.
Yeah, it's way too early in the morning. I need some red wine for that day.
The reason we say this, Dave, is we had a guy named Giulio Sagantini last week, and he's an expert on cold calling and prospecting, and he shows up with a gold vest and these gold glasses, and
looks like a DJ.
He looks like a DJ from the 70s. Yeah. So
I got a pocket square. I mean, I can't compete. Yeah, with some red wine, I could probably try it, but I don't have enough vowels in my name. Yeah.
Yeah, that guy is a trip. He tells us he makes cold calls all day long for a living, and then he teaches companies how to make the cold calls. But he's on his TikTok and his Instagram, he posts where cold calls go bad, where he's on them. So Sully goes, you ever tried like when one's going bad, just say, well, what if I did it in an Italian accent? He's supposed to be posting one of those here before too long.
He did.
But did he? I hadn't seen it.
Oh, yeah. So, Dave, you love this, right? So he's given all this great advice on cold calling, and we're having an absolute blast. And, his accent, his energy just stands out. And I said, listen, when you get rejection on the phone, why don't you just go into some full-blown Italian they can't even understand? You just freak them out. And he's like, I'm going to try that. And wouldn't you know it, Scotty, 2 days ago, I pull up TikTok, and he did it. One was recorded, and the guy's totally dissing him. He goes, well, what if I did it in an Italian accent? And the guy starts laughing, and he says, all right, go ahead. And the call goes 20 minutes. He gets the next meeting. Right?
That's awesome.
He pulled it out of the fire.
That's it.
Yeah, this is what you get for a living.
Guest suit.
You're giving counsel and advice to a guy who's an expert, and it's working. Look at that.
It's
right.
Working. That's right. That's right.
20 days to the top with Brian Sullivan.
That's awesome.
Take it away, Scotty.
Hey, before we get going, Dave, why don't you just kind of walk the audience through your career and kind of catch them up to speed with where you're at today, and then we'll jump into just some Q&A.
Sure. Thank you, guys. And again, it's awesome to be with you guys. I was privileged to grow up in a household where healthcare was what we talked about every night at dinner. My mom and dad grew up in Greensboro, North Carolina. Both of them, no indoor bathroom, log cabins, really. And they are 90 years old today, and they have off and on been together for 83 years. He gave her his watch when he was like 6 years old. They went to kindergarten together, and so it's pretty cool. They've been married close to 70 years now.
Wow.
And I've got my mom's diary here when she turned 11. She's writing about my dad on her birthday when she turned 11.
way.
So it's pretty cool. So they grew up in Greensboro, where the big industry was cigarettes. And I remember my dad at a very young age said, I just knew that wasn't going to be the future. It wasn't right. I didn't want to be a part of it. And the other big industry in Greensboro was Vicks Vapor Rub. So he and my mom both packed cough drops at night. And they said we had to date each other because we smelled like mentholatum. And like it stuck. It worked. And our first job was in New York City.
That's what Sully's people at the golf course say to him all the time. God, you smell like mentholatum.
He doesn't have the excuse of being able to set cough drops at night. Yeah.
No, it's more.
That's actually Ben Gay. It's Ben Gay. Sorry.
Well, so that I mean, he grew up doing that, and then ended up with Vicks and Human Resources, and then ended up at Global at Vicks doing Human Resources. So he would all over the world, sort of evangelizing that brand, and then ended up at Mallinckrodt. And then when we got to Chicago, where I grew up, outside of, we went from St. Louis with Mallinckrodt up to Abbott in Chicago, and so he has just sort of evangelized to our whole household since we were kids. Like, you're going to have this one career, this one opportunity to leverage your time, talent, and treasure, pour into something you care about, do something that matters, and do something that's bigger than you. And he said, for me, it was this idea of, I'm not only going to reject the cigarette industry, I'm going to pivot entirely and go into something that benefits mankind. And obviously, with Vicks being in his hometown, that was sort of an on-ramp that he couldn't have known at the time, but ended up being, part of Abbott Laboratories in their growth years in the 80s and 90s on the international side, where that was the fastest growing piece. So that was dinner table conversation for us growing up. So when people say, I love Simon Sinek and I love the idea of what's your why, I got it from my parents, who said, look, your responsibility, if you're born in the United States and you're born into an opportunity that almost nobody in the history of the world has had, leverage what God's give you to make an impact somewhere. So that's kind of how I got into it. He wrote a nepotism clause at Abbott to make sure I was never allowed to work there, nor was my brother or sister. So he kind of put up a note why Abbott today is thriving. And but I lived in Libertyville, Illinois, sort of a Norman Rockwell upbringing there in Libertyville, Illinois on Paradise Lane. But the cool part about that was we had Medline and Mundelein one town over. We had Abbott Park right there. We had American Hospital Supply right there down the road.
Colonial Hospital Supply. Remember Colonial Hospital?
Colonial was there? Oh, yeah. I mean, so there was just this target-rich environment. And I was going to go to Georgetown Law School. And he said, hey, you don't know it yet, but you're a sales guy and you need to be in healthcare sales. And here are some companies right around our area to go look at, talk to. So I ended up at American Hospital Supply, which was purchased pretty quickly after that by Baxter. And that launched my career. And looking back, I'm so grateful because I got that experience and opportunity to learn from those pros at American Hospital when it was kind of the place the magnificent persuaders is what Fortune magazine called them. And it was a great place to learn and listen and kind of look up to these icons in the industry. And that led me to kind of where I ended up. But that was the start of it. But it all came from what's your why. And as I get older, I have to say, it just sort of reinforces that we don't know how much time we've got. And if you're going to work as hard as we all do, and if you're going to pour into something, pour into things that are going to make an impact. And I look at healthcare and I think, geez, it's approaching 20% of the economy. It's not necessarily getting the outcomes that we're paying for as a society. And I want to be a part of improving it with whatever time I've got left and with whatever influence I have. And that's kind of what motivates me every single day to this moment. So that's kind of how I got here. And it was that shaping from my mom and dad and that foundation that I had, Scotty.
Yeah, it's a great story. I love it.
So Dave, let's go back to first of all, I think the three of us will always say that the healthcare industry has been so good to us.
100%.
Yeah.
I mean, just the number of friends and who've become like family. It's a really fun industry, and I think that's probably the greatest asset that I've gotten out of it over, the many years I've done it, just the number of real deep friendships. And so, but I want to get back to the specifics of healthcare, right? Because in the premier world, you're really embedded in it. Last week we had a guy named Brian Kudeback. He's a VP of healthcare sales at Cigna, right? So we really tried to tackle the what's in the mind of those insurance executives, right? Because you got on our side, we got manufacturers who make the new technology, right? And then that technology's got to get off to the distributor who's got the relationships and the agreements, and right, and then someone's going to pay for this, and that's either going to be the government or the Cignas of the world, and then there's Premier and there's you, right? So where do you fall in that mix as Premier? And how does Premier solve this 20% of GDP? Like, what are you guys thinking of when you say, here's where we can help? I've got Dave's why, you got your personal why, but what is Premier's why in this whole thing?
Yeah, that's a great question. Thank you for that. And I'm going to tag on to something you said, which is we're so grateful to be in healthcare. I'm also grateful for the opportunity Premier's afforded me because we do sit in the middle. So when I was at American and Baxter, and then I had the privilege to go with a startup, and then I owned my own company or helped own the company inside of that. And then I came to Premier. So I've had this opportunity to be on sort of all sides of this business and that learn and hopefully contribute along the way. But Premier sits in the middle, as do our competitors. And so the lens opens up, the aperture opens so you can see things much more clearly. So our job today is to listen and understand the needs and uncover the needs of the healthcare executives running the biggest systems in the country. And our job, if we're doing it right, is to really listen and learn and then come alongside those executives and say, I can't help you with everything, but I can help you with these things. So when you talk to the CEOs of today, they're looking at a lot of things. There's sort of the tyranny of the urgent, which is access and cost and their own margin, because no margin, no mission, obviously. So they're very worried about just the post-COVID world of right-sizing the ship, et cetera. But longer term, the ones that are more visionary are looking out, 2 quarters out, but 5 years out and saying, okay, how do we move from where we've been in this world of heads and beds into a world of population health? How do we move into a world of consumerism? We're ill-equipped for that. We're not. That's not how we came up. We didn't get into these jobs by being good at that. Matter of fact, we got here because we were good at the conventional way of doing things. So they're soon going to be eclipsed by a new way. All these burgeoning technologies, all of these emerging competitors. It could be the drugstore down the street, or the drugstore chain that was your partner and now suddenly is encroaching on your space with a dock in the box that's siphoning off your primary care folks. How do we move into the continuum of care settings and the venues that are going to be relevant with low costs and great outcomes and convenience for consumers? Because I can tell you, with 3 boys that are in their 20s and 30s, they won't put up with the stuff that we put up with in terms of the inconvenience and the sometimes lack of coordination in healthcare today. They're going to find automated ways or technology ways, or they're not going to do it. It's going to be an alternative. So when I think about where our executives are and where Premier is, we're trying to align around how do we acquire and retain the best talent? How do we prevent burnout of our physicians and our caregivers? How do we help with access and overall cost, but also work on social determinants of health and things like maternal health? I just heard a statistic the other day from the CEO of Rush Presbyterian in Chicago, and he said, where I'm standing on Michigan Avenue, the life expectancy is right at 89. If you go 5 bus stops away, it falls to 69. And he said, so we shouldn't live in a world where 5 bus stops away, less than 5 miles away, the age that you can expect to live is going to drop by over a decade, and in this case, almost 2 decades. So we've got those as ongoing issues, but we also have this whole thing as taxpayers. And look, Scotty, I know you pay a lot of taxes. I'm not sure, Brian, if you do. You've got a great accountant. But the bottom line, you own your own business. So there's probably legal avenues.
We pay more than we're supposed to. I can tell you that.
But as a taxpayer, you're a healthcare professional. Increasingly, as you get older, you become a consumer. But you're also a taxpayer, and you look at this and say, this is untenable. And I just read a great book and from a new friend of mine, David Johnson, and he talks about the customer revolution in healthcare. And he goes back to Eisenhower's sort of speech as he was leaving as the president of the United States. He warned about the healthcare industrial complex. And back then, he was worried about just sort of the defense contractors working with Congress and funding sort of this permanent industrial complex that would start to encroach on other areas of the productive economy. And he said back then, defense was about 9% of the budget and healthcare was about 5%. So flash forward to his warning, and we now have sort of a healthcare industrial complex where we're almost at 20% of GDP, and now you've got defense spending falling to 3%. So you look at that and say he was warning about all the signs that he saw, but he had the wrong industry. His admonitions are actually more relevant for kind of where we find ourselves today. And if you look, France has spends 12% of their income on GDP on healthcare, and they live to be an average of 4 years older than we do. So we spend close to 20, which on our scale of 337 million Americans is dramatically different. That gap in 19%, 19 point something percent versus 12 is dramatic in terms of dollars. And yet we're not getting commensurate outcomes with those expenditures. So that's what we're motivated by at Premier is how do we help those health systems not only succeed in today's environment, but how do we help them move to where they need to go? How do they make moves today strategically? How do we use automation? How do we use technology? How do we use data? How do we use the data that creates the insights that allow them to change the way they do business to help manifest better care at a lower cost? And at the same time, cast a wider net on access and social determinants. That's where you get to healthcare, the improving the health of communities, and that's what we exist to do at Premier. So I'm not going to tell you we do it perfectly every day, but that's what every single person at Premier wakes up thinking about is that mission. How do we get there using what we've got sitting in the middle? And
let me ask one follow-up to that, Scotty. So Dave, if you could do one thing, you're the main man. You can do one thing to take that from 20% down to 15%. Where do you think we need to attack?
Boy, that's a great question. And I don't know that I've got the answer, but I think it would be if I was I'm making myself not a bureaucrat at this point, Scott, because you said I'm the main man. I'm going to give myself godlike power.
You're right. You're right.
Yeah. Godlike power.
You're part of the medical swamp, Dave.
Yeah, that's right. You know what I would start doing, Brian? I would start talking to
now we get live.
Yeah, I would start talking with an Italian accent, and they would take it more seriously.
Hey, Dave's about to look at you and say, to be the man, you got to beat the man.
Yes. Honest to God. No, I think if I could wave a magic wand, it's the perverse incentives. Is everybody is making money in their own ecosystem. It's not illegal and it's not unethical, but it drives behaviors that collectively drive the cost up. A surgeon is paid to cut. A hospital is paid today in the traditional way to get more patients in those beds. And so everybody's doing the right thing for their part of it. Pharmaceutical companies are chasing the high end things like oncology treatments where you can get $2-3 million a year for that therapy. I don't blame any of those things. Those breakthroughs are what are driving longer life expectancy, et cetera. We're benefiting from those. But in aggregate, all of those perverse incentives help to contribute to getting us where we are. So if I could wave a magic wand, it would be to align incentives around prevention and true population health, and then move towards health versus better patient care. I want to get to them before they're patients. How do we take somebody who's on a track to be diabetic and prevent that chronic condition from happening? It's that 5% of all chronic conditions that add up to something around 78% of all the cost. So how do we address that root cause stuff? And we're the richest society in the history of the world, and we're the smartest and most innovative society in the history of the world. We ought to be able to do it, but it is these entrenched interests. It's the other thing, since I'm God for a minute, Brian, is I would love to knock down the silos that kind of create cartels, because I just am a giant believer that it's in monopolies that bad behavior, whether they mean to do it or not, can persist. Almost everybody loves to tell a story about how they can't stand their local cable company. And I always think, well, how does that exist in a working free market? If they're lousy, you would choose somebody else. But then I realize in most cases, they've got kind of a little oligopoly or a cozy little deal where they are the player in their specific market. So they don't have to be that good. And I worry that the same is true with healthcare, whether that's a provider, whether that's a pharma company with a 17-year patent. Competition makes us all better. Competition is what makes everybody better. And if you can break down those silos as you're working on aligning the right incentives, I think you could change the world.
Hey, you know, so I was fortunate enough to meet Dave through Pritchard, but Pritch tells a great story of how he met Dave 20 years ago. They were coming back from a meeting, and John was kind of new to the industry, but he knew who Dave was. And he went up to the lady. This is back when Delta gave you the coupons where you could write, somebody did a great job. John went up to the lady at the thing, and he goes, I will give you my entire book of these, and you can write whatever you want if you have me next to Dave on the flight.
No way.
And he's like, he goes, and so she put me next to Dave, and he goes, then I find out, somebody tells me right before we board that Dave's notorious for when a military person gets up, he gives him his first class seat and moves to the back. John's like, if I'd have knew that before, I'd have never given those coupons away.
He sat next to a drill sergeant instead.
Yeah. But fortunately, he got to sit with him the whole way. Anyhow, I tell that story just because that's the kind of guy Dave is. But Dave, you know, what made me want you on the show more than anything is you talking about finding your why. And Sully, I don't know if you got the pictures I sent over to you, but there's one of his whole family. If you could pop that up, and Dave, kind of walk us through, your whole, kind of comment on finding your why, that type of stuff.
Well,
you know which one I'm talking about? Right.
Oh, we got a ton of them here.
Yeah, that's my
young one. Yeah.
Yeah, that's my immediate family. And Scotty, you're responsible for the guy on the right having a job to be able to support those kids. So thank you for that. That's what got about. So those are my little granddaughters. And I feel like as you get older, you sort of see the full perspective of healthcare from entirely new eyes. In the same way, when you go into a hospital as a patient versus somebody who's selling into it, you sort of realize, oh my gosh, this is very different now. I'm seeing how my products or services are used. I'm seeing the errors and mistakes and the things that are frustrating to work with. So, Brian, my family that you just showed, I've got 3 boys. They're all married, and my oldest has 3 little granddaughters. So now I'm looking at this thing, and there's a real imperative and a sense of urgency around, I don't want them to inherit a flawed system that I may have inadvertently contributed to those flaws and contributed to the bloated cost with the lousy outcomes, et cetera. I want to do what I can to try to impact that. But at the same time, as I get older, I've now had a total knee. I've had a couple of other procedures, and you start to realize, oh my goodness, I'm a consumer as well. And then I go back to, I've got my parents, they're 90. My dad still sits on the heart and vascular board at MUSC here in South Carolina, where I'm at their house today. And is still contributing at 90. He got up this morning, put on a tie, was out the door before I got up at 7:15. Yeah, out the door to go to a board meeting. And so he's living that.
I just sent you a picture of him, Sully.
They are modeling how to do it, but they're living how to do it. They're living around like he reads the Wall Street Journal from cover to cover, stays up on the latest medical technologies, not only with his own company.
That's awesome.
Yeah. So
this is where you get your good looks.
Oh, yeah. 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 How about, that's pretty good. That's 89, and they've been together for 83 years.
That's awesome.
Good.
Who's that hot looking lady next to him?
Yeah. Yeah. He will say it's my first wife. So, yeah. So Sully, that is what motivates me, is this idea that we're going to ask our grandchildren and our children to pay for our party. And I think one of the things that struck Scott was the unfunded liability for every American, including those that have been born while we've been on this call, Brian. Is now, it was about $983,000 per. It's now over $1 million for every person in America on the unfunded liability, which is essentially to pay for our cost of healthcare. That's the promissory note we've written for Medicare and Medicaid for our generation. So I'm 62, 10,000 people a day join Medicare. That means they turn 65 every day. 10,000 people go from paying into that system, and now they're participants in that system. And it happens at the very moment they start to draw out of it because they're starting to need healthcare in a more acute way. And so that's the part that we never had the political courage to change. When they put these laws into motion under Lyndon Johnson in the early 60s, the average age was about 64. That's what you had to, if you were in good shape, you lived to be 64. So there's a reason Medicare kicks in at 65. Most people never got there. And now that people are living going to be somewhere right at 88, 89 years old, women living longer than men in this case. And again, it depends on your zip code. Unfortunately, we've got to address that as a society. But at the end of the day, we never changed the math. We never changed when you could retire, when the benefits kicked in. And if you live long enough, you will almost guarantee that you will take more out of it than you ever paid in, including interest. So even though it's not an entitlement, because everybody put into the system, by living that extra 30 years, you literally end up taking out 4, 5, 6 times as much as you did contributing to it along the way. And then you've got a smaller cohort of people, Brian, behind it carrying us. And that's the struggle. That's the why for me.
All right. So Dave, do we really want people to live longer?
Yeah.
Some of them.
Let's have this chat. Right.
Yeah.
So and let me take it back to something you said earlier, right? That the healthcare industrial complex, right? And the incentives probably aren't aligned correctly. But, I was watching something last week, and I couldn't tell you who it was, but they were talking about just how unhealthy we are. Because you talked about if we can prevent disease, it's cheaper for the system. Okay. And I think we all agree with that, right? Preventive healthcare has been a thing for a long time. But they talked about even the, let's take the sugar cereal industry. Okay. So they were using this as an example and showing the commercials of the Fruity Pebbles and right, and they helped. Oh, this is going to be healthy for you, and then they showed moms saying, what, this is fat shaming. What, my kids should be able to eat whatever they want, right? And so the money being pumped in to industries that are purposely making our population unhealthy. Someone's making money on that thing. Okay, now that leads to diabetes. All right. Well, now, go back to I said, Dave, how would you solve it? I don't know if we can solve it just in healthcare.
Yeah,
I think it's got to be solved outside of healthcare as an example of this. Otherwise, people are in dialysis, and I mean, it doesn't mean it's too different. Everything's solvable, right? But until I think as a culture, we change the importance on health. Even during COVID, if you were healthy, you were probably going to be okay. What would that have saved the system? How many lives would have been saved in that? But you don't want to do that because it's going to cost someone money. People are making money off of fat people.
Well, I guess, first of all, it's a great point. But this is where, to me, that intersection of personal responsibility, education, and aligned incentives. So in other words, if it costs me, if somebody else is paying for my care, maybe I don't care quite as much about my care because somebody else is paying for it. That's back to perverse incentives. Whether, if I'm the example you used, it may be somebody that's using the emergency room as their primary care doctor. So that's probably a bad example. But for the most part, if somebody else is paying, then I probably don't have the right incentives to take care of myself.
Hey, Dave, that's how Sully feels when he goes on to speak at meetings. If somebody else is paying, I'm riding first class, baby.
That's right. That's exactly right. Hey, I've seen it in hospitals where physicians want a certain product at the hospital and they're willing to settle for a different quality of product when it's their own, surgery center or ambulatory care setting or whatever. But absolutely. So if somebody else is paying, automatically, maybe you're not paying as much attention, even though it's your own health and you should be. There's a giant education component to this, not a shaming as much as, here, we want you to be empowered by the facts. And there's a personal responsibility component as well. In a free society, I don't want the government telling me I can't do something, but I can educate people about here are the costs of those decisions. It runs right into my sort of the principle of like even something as simple as should you have to wear a helmet when you're riding a motorcycle? As somebody who really hates government overreach, I say, as an independent person that's of age, wants to go do that, take their own life into their hands, knowing the statistics on that are really pretty bad. That should be their autonomous decision. They're empowered to make that decision in a free society. But if we all bear the cost of that bad decision,
they got to jack those rates up.
That's right. And collect. Well, then suddenly there is another point of view here. If somebody else is paying for that health care. Yeah. So these are messy, complicated blurring of lines, Brian, in my opinion, and not easily solved. But education solves a lot of it. Aligned incentives solve a lot of it, and personal responsibility, which people we created this country based on that concept. And I think we've gotten away from that a little bit. There are certain decisions you can make, just starting with not smoking, that have literally lifetime benefits. And the corresponding thing is also true. The converse is also true, which is if you make certain decisions early on, it almost certainly will not only have a deleterious effect on your life, but it will shorten your life by 2 or 3 decades in many cases, and complicate it too. So look, this is the great struggle for, I think, our generation and the next. It's all the things we want to do. I think Republicans and Democrats would all agree we want clean water and clean air. We might disagree on how much it costs and who pays for it. I want Brian to pay for it. Others would say, but for the most part, Republicans and Democrats can come together. We want a strong defense. We want great schools. We want good roads. We want great economic opportunity for people of all classes, regardless of where you're born or what your color is. Everybody wants opportunity. The question is, how do you prioritize those things? And who pays for them? Those are the two questions that come back. And what I'm seeing is increasingly healthcare, because it's become this burgeoning behemoth. It's crowding out, including just automatic adjustments to the Medicare rates. It starts to crowd out other things that we want to do. I want good schools. Oh, there's not enough money for that. We need to improve our roads and our infrastructure. Bridges are collapsing. We need to fix that stuff. Well, where's that money going to come from? There's a finite pool of money. There's a point at which we're not going to be able to continue to expand. And just now the debt itself has become so big that servicing that debt also starts to crowd out other opportunities. And here we are about to pass the 20% threshold. We have countries that have better outcomes with us at half of that expenditure. It's untenable. And that's the sense of urgency I have. And I look at those.
Have you been a doctor or had any procedures lately?
Me?
Yeah.
Yeah. I had my annual 2-3 weeks ago. It was a wonderful experience. I asked for a second opinion.
I'd have done it for free.
Hey, Scotty, most people don't get knocked out for that, Scotty. Did you ask for propofol?
No, I wanted to be awake.
You wanted to be awake. Good for you.
But my question to you was, how much was that physical?
Free. It's part of my insurance program.
Okay. It wasn't free though. It wasn't free though, right?
No, it's whatever we're paying for insurance.
Oh, right. Well, the example I'll use is they just had this with my wife, right? I needed a mole removed. Never knew how much the mole was going to cost. All right, I figured I could take this thing off. Well, the bill came, and we have a high deductible plan. And she said from the kitchen, "Honey, it was $1,800 to get that damn mole removed."
And you didn't even name it.
I have to ask, was the mole the size of the eclipse, right?
Yeah.
I'm trying to picture the size of
You got to give that thing a name at $1,800.
Austin Powers vision right now from that movie.
Listen,
yeah.
I've never seen it. Back to your point, Dave. I don't think there was a mole back there. He picked the perfect spot that you can't see. That bastard took that thing off and made $1,800. Right? Right. And then my daughter, she's on the cheerleading team, and she hurt her ankle. We went up to the offsite ER, and it was her bill, and we were in there 20 minutes. They wrapped it. It was $800, right? So here we are. We're sort of unaware. But now, in reality, had I known it was $800, because I didn't think she was just being a wimp. In reality. Right? She just had ice, and for some reason she felt like she had to go to that ER. Right? Well, if I knew it was $800, Dave,
yeah,
we would go to that ER. But you see, I would say there's a lot of lack of knowledge. Here is what you are buying. So how can people make decisions that save the healthcare system if they don't even know what the price is and what the price is?
I think transparency. You nailed it. Transparency is really, really important, and all sorts of stakeholders across the system don't like transparency. You think about just how opaque a lot of different businesses are inside of healthcare, and how it is probably the only business you're in where you don't know what you're going to be charged till long after you're out. I've eaten the ice cream cone. Now you're going to give me the bill. It's crazy. So I do think that transparency solves a lot of it, and it educates people on decisions. To use an example that's different than your mole removal, but in the United States, the average cost of a conventional baby being born, non-C-section, is right at $9,000. Is $9,000. So the second most expensive place in the world to get your baby is if you are doing it in St. Mary's Hospital in London and you are the grandson of the King of England. That is less than by $2,000 what it costs for us to have our babies is a national average in the United States. That also came from that Dave Johnson book. And to me, that was such a great epiphany. Here it is, just a regular hospital in America, $9,000 for a baby, which, by the way, becomes a deterrent to having children. At a certain point, people say, my God, if that's the cost right out of the gate, what's it going to cost me over a lifetime with college and all the other stuff? So I do look at that and say, we have a problem. We have a problem, and we have to come at this. And the other big piece of it, guys, I think government is part of the solution, but we can't look at government to be the solution. Yeah. They can play an outsized role. And I'll go back, Brian, to why did I stay at Premier? Why did I come back to Premier? Not because Premier has all the answers. It's a great company with great mission-oriented people, and we've got some amazing data and insights that go with it. But it's because we sit in the middle. We can influence stakeholders across. We have an influence with pharma, an influence with device, influence on the distribution and manufacturing side, influence with providers across the continuum of care, and an influence with the people paying the bill, whether that's the government or whether that's the insurance companies. So we can't mandate anything, but we can play a role with at least highlighting and showcasing and spotlighting. Here's best practice. Here's how you get the lowest cost. Here's how you get to the best outcome. Here's how you get to the best patient experience, drawing across 2,400 hospitals to get to that outcome. So that's where it's exciting to me, is to be if somebody's doing it better and somebody's got a better patient experience, how do we leverage that and help other people benefit from the work you've already done?
Dave, I'll shift gears on you a little bit and let's get away from government and talk a little bit about, we on this show, we talk a ton about, hey, sell the problem you solve, not the solution. So as you're thinking about that, what are 2 or 3 things that you would tell suppliers today calling on your hospitals, your systems? Here's the biggest problems that they're dealing with. You've got to figure out how to help them solve those.
You know what amazes me the most, dealing with having been a supplier and a couple of different times in my career, and now still interfacing with them a great deal. There's some great ones, amazing ones. And like you said, Brian, a lot of them, that's where the innovation is coming from, whether it's pharma or device. They're coming up with new techniques and increasingly technology. So my heart, but inside of my DNA is still, I'm a giant fan of the whole manufacturing, supplier, distribution community in healthcare. But I'm still amazed in a world, Scotty, where you guys have tools to make sure they walk into an IDN and they know everything about it. They should know more about their problems than the health system themselves, because they actually see other hospitals in other regions, et cetera, whereas the hospital executive has got a kind of myopic focus on their own stuff. And I am shocked when people come in at a high-level meeting and don't know just the elementary stuff that is widely available with things like your IDN program that you guys create. You can walk in for a couple $1,000. You can have your whole sales team empowered with all the relevant and most recent data points about who's on their board, what do they care about, did they make money or lose money, how do their statistics line up from a value standpoint, are they in the 100 top hospitals or not, and if not, why, did they fall out, did their bond rating change? All that stuff is directly relevant to how you curate your story and customize the approach you're using with the hospital. So I am blown away in this day and age with that availability of data and the fact that, Scotty, you provide it. Yeah, I'm still blown away that people come in and then they don't get the second meeting and they can't figure it out, Brian. And they hire Precise Selling to come in and say, "Where are we going wrong?"
Hey, I will say that was a shame.
Of our businesses. Did you pick up on that?
Yeah, I was about to say that was a shameless plug for the IDN directory. For those of you who'd like a demo at any time for over 15 minutes, please let me or John Pritchard know.
Hit the link below.
Yeah, hit the link below. We actually just added who the prime vendor was in every one of the health systems we've identified across the United States. So that's in there now. Seriously, Dave, thanks for the plug, man.
No, but
I agree with you
from my heart.
Why would you not know that information? When it's there.
I have a good friend of mine is Mark Dixon, who you guys know. He's been on your cover before. He's a fantastic guy, and he's been the CEO and COO of a number of big health systems. But he tells me all the time, he gets his peer group, people that he mentored that are now CEOs of large systems, constantly say to him, "You're not doing your job," because these guys still come in and they talk to me about their product, their features and benefits, their solution to my problem, which may or may not line up to my problem. So it comes back to me, Scotty, to just listening leads to learning. Learning allows for understanding. Understanding is what enables alignment. And alignment is what builds trust. And trust is the foundation of every relationship that matters, whether it's your spouse, your neighbor, your friend, or your business partner. And at the end of the day, people don't do enough listening. And I would add to listening this idea of doing all your homework ahead of time. So when you walk in there, you come in, you already have a point of view on what you can do. You probably can't, and I'll use Premier, we can't solve all problems, but we have a really good line of sight to solving a bunch of problems, including things like unwarranted variability that lead to bad outcomes at higher costs. How can we uniquely help you with that? We should already come into that health system conversation with a point of view and with at least the requisite background knowledge that makes the conversation relevant. And that's when I see people not doing that, Scotty. The other thing that cracks me up is when I see people going right to the top to try to change a decision that was made. I almost have never seen that work ever. But mostly it not only doesn't work, but it's a scorched earth thing, and it's going to backfire. And people have an elephant's memory, and you will never be invited back in there again. So sometimes being a good loser and saying, I'll be back